Why Bangladeshi patient go to Iran for treatment?
The prices in Iran compared to Thailand, Singapore are one-third.
Because I know that infertility treatment is very good in Iran.
Well-known doctors has been studied in Iran. Korean Bangladeshi doctor has been studied for their specialty in Iran.
What are the steps you are taking to make the treatment abroad more affordable for Bangladeshi patients?
Accommodation starting from $5, $10 per night to $100 per night, so they can choose according to their budget.
Hello,
Hello.
Mr. Ali Bazazi. How are you?
Thank you. Fine. Thank you. How are you?
I'm fine. How you are feeling in Bangladesh?
Culture of Bangladesh and people in Bangladesh are very similar to Iran, so it's not strange for us, and it's my fifth travel to Bangladesh.
I know that you are in health travel field for a long time and you mostly promote treatment facilities in Iran. So why Bangladeshi patient go to Iran for treatment? For which specialties they are going to Iran?
There are many reasons to choose Iran from Bangladeshi patients. One of them is legal rules according to treatment for some services like organ transplant, like infertility treatment. The rules of Iran are very smooth, and we welcome to many patients worldwide due to rules. On the other hand, the prices in Iran is even lower than prices in your neighbor countries like India or Turkey, other destination. So this will make Iran interesting for many Bangladeshi patients. This is beside the religious connection between Iran and Bangladesh, and many other factors may influence this.
Yes, right. Iran is an Islamic country and Bangladeshi people like Iran very much. So if you compare with treatment facilities in Thailand, Singapore and Malaysia and India, what is the main specialty in India compared to these countries? Because you know that most of the Bangladeshi patients are traveling in this country. So why Iran will be a choice for them?
As I explained, legal aspect of these services is one important factor that affects the travel of medical travelers or patients to Iran. On the other hand, the prices in Iran compared to Thailand, Singapore are one-third. It means the expense of these packages are 3 times more in Thailand, Singapore, and even less than India. The prices in Iran are even less than India. So I think Iran is a good destination for medical travelers from Bangladesh, but still many patients do not know about Iran. So maybe we need some more time to promote Iran as a good destination who welcome to Bangladeshi peoples. The other aspect is visa. TebMedTourism can receive the visa for Bangladeshi patients within 3 or 4 days, which is really interesting at this situation.
Well, it's a good thing that a Bangladeshi patient can get visa in Iran for 3-4 working days.
Yeah.
It's for maybe for patients.
Yeah, for medical visa.
Okay, so how many days visa you issue for patients for Bangladeshi?
You mean the visa, the
Visa
for
duration
visa?
for the.
When the patient receive visa, it is valid for 3 months to enter Iran, and after entering Iran, the patient can stay for 1 month. But if the treatment has not been complete, like some cases like organ transplant, kidney transplant, we may extend it each time 1 month. Okay. No limitation in extension of the visa.
I know that medical education and hospital facilities are very good in Iran. So what specialty of patient you are getting more from Bangladesh?
As you said, the quality of services and hospitals and medical professionals are very good level, and many of Iranian doctors are working or has been graduating in United States, Western countries, and the quality of equipments and services are the same as Singapore. In fact, this is what many of our patients. The services that we receive include all treatments. I'm a medical doctor, so I have very good connection with different doctors in Iran, and I can cover all types of services there. But at least till now, most of our patients come for kidney transplant, come for infertility, including surrogacy, egg donation, gender selection, IVF, and then cancer treatment. These are the most prevalent services that we provide in Iran till now, but we are open to welcome for all medical services.
Thank you. So currently you are receiving patients from Bangladesh for transplant like kidney transplant, infertility treatment and other aesthetic treatments also.
Exactly.
Because I know that infertility treatment is very good in Iran, and you also have some gender selection facilities that is not available in other countries.
Yeah, exactly. That's right.
How is the number of health travelers changeover in past few years from Bangladesh? Because you were working in this country for last 3-4 years.
Yeah.
So what are the changes you are seeing in current years?
Alhamdulillah, our patients and the people of Bangladesh, people who rely on us increase year by year, maybe twofold, threefold more each year. In last few months, due to the war situation in Iran, we request our patients to wait for the situation come down. But Alhamdulillah, these days the situation is much better and the war has stopped. So we expect a large growth in the number of patients with the negotiations that we did here, with the branding that we did during our maybe more than 4 years of activity, which has been prominent in last 1.5 years.
Yes, I see in a few years back, people have a wrong perception here in Bangladesh that Iran is not a good destination for treatment. But now the things are changing and people now not available in Bangladesh.
Exactly. Many of well-known doctors has been studied in Iran. Many of well-known Bangladeshi and experienced Bangladeshi doctor has been studied for their specialty in Iran or even for general practitioner GP level in Iran. And they are good ambassadors for Iran, and they can say what is the reality of medical system and quality.
Yes, when they come back, they
Exactly.
tell the stories to other people, and then
Also the patients see their quality of services when they provide service.
And recently, I know that you are also working for skill development of the doctors in our country. So, if you tell in detail, it will help.
Yes, of course. I think it is I, as an Iranian doctor, responsibility to help to empower the quality of healthcare system and education and equipments in Bangladesh. Because 40 years back, many Bangladeshi doctors come to Iran and help us during the Iran-Iraq war or during many hassles that Iran faced. And now we are responsible to answer this. During my meeting with different hospitals, with colleagues, I tell them that we are ready to school our doctors for a short courses, 6 months, 3 months courses in Iran to make them more skilled. Of course, they are very skilled and professional, but we would like to make it more skilled and professional. On the other hand, on behalf of Iran Health Minister, I want to convey this message that we are ready to send some Iranian doctors to Bangladesh for some operations or some online operations and robotic surgeries, which will gradually make the Bangladesh powerful enough so that Bangladesh patients do not need to choose any destination for their treatment, and they can receive top-notch, best services inside their country or even their cities.
Yes, we need collaborative approach
Exactly.
in government to government level.
Exactly. Although government usually in the world do not take their role in this part, so it is our private department responsibility to be ambassador of our government and do what we should.
So, what are the steps you are taking to make the treatment abroad more affordable for Bangladeshi patients?
We worked hard to make a direct flight from Tehran to Dhaka and Dhaka to Tehran, and Alhamdulillah, this MOU has been signed between Mahan Airline and Iranian airline with Iran embassy in Dhaka a few months back and before the war. And as far as I have heard, inshallah, in next 1 or 2 months, direct flights will be started. This will be a great step forward. On the other hand, we offer them variety of accommodation starting from $5, $10 per night to $100 per night, so they can choose according to their budget. The next one is we made Bangladesh visa free of charge. In fact, TebMedTourism sponsor visa expenses for Bangladeshi patients who want to come to Iran. We receive their visa approval. They just should attend Iran embassy in Dhaka to get an stamp, and that's all. No need for any payment for their visa. These are the steps that also we negotiate with the hospitals to give a better offer with high quality services, but a better offer to our Bangladeshi patients.
Great. It's a great news for Bangladeshi patients that direct flight will start soon from Iran to Bangladesh. And other thing is that it is very good thing that Iran embassy and TebMed work together to waive the visa fee for Bangladeshi patients. So it will help Bangladeshi patients to reduce their cost. And I know that accommodation, you told that is a patient can get in $5 or $10, and food I think not that costly in Iran. So it's a good affordable destination for Bangladeshi patient, that I think. So what do you think that Bangladesh is a good market for Iran for health travel?
My experience during the travels to Bangladesh said that Bangladeshi people has very good mindset and very good friendship with Iranians, and Iranians really love Bangladeshi people. This good relationship, this feeling from the bottom of heart make this travel very smooth and very easier for Bangladeshi patients. So I think this is very important for the prestige of the Bangladeshi patients will be respected in Iran as it must be.
Right. And I can remember that in my childhood days, I went with my father in Iran Cultural Center, and I saw that Iran is very developed in cultural issues, and on the other hand, it's a good destination for tourism also, because a lot of historical places are there. So what is your opinion regarding that?
Of course, we are in negotiation with the embassy and Iran Foreign Affairs Ministry to allow us to issue tourist visas as well. So in a group of 20%, 40%, 50%, Bangladeshi people can travel to Iran, see the cultural heritage, see the historical locations, also the friendship of the people, take videos, share with everyone, so that this gap between Iran and Bangladesh will be filled very soon, inshallah.
Inshallah. Another thing is that when patients come back to Bangladesh, they're all are critical patients like transplant patient, and some patients are from infertility. So they need next follow up. So how you will solve these issues, because there is some distance. So how we can solve this issue?
We are to support our patients till they request. For example, for fertility clients, we get family members because we, alhamdulillah, very high success rate. We give birth to their baby, and they say this baby has been born in Iran or belong to Iran. That's why this familial relation, each time that I travel to Dhaka, for sure I meet many Bangladeshi patients who were our guests in Iran. On the other hand, for some critical services like organ transplant, they should do monthly checkup for the level of the medication inside their blood and share with us, and we respond and set the dosage of the medications. The other thing is we have make everything automated. It means we receive, the related consultant receives notification every week at the beginning, then every 2 weeks, every month, to knock the WhatsApp group of the patient and see how is everything okay or not.
Okay.
The consultant receives notification not to forget to follow up the patients.
Great. It's a great thing that after coming back to Bangladesh, they are in touch with, of course, doctor and hospital.
Yeah.
That
is their duty to continue the process till they get sure everything is fine.
Another issue is that for international patients or health travelers, there is an issue for language barrier. So how you solve these issues for language problem?
Yeah, we have an active office in Dhaka, in Bangladesh. Our brand TebMedTourism has been registered in Bangladesh. 3 persons are working inside our office. So although they are not a medical team, but they can help to answer some questions according to visa, contract, and everything. On the other hand, we have two Bangladeshi colleagues in our central office in Tehran, who will accompany the patients from A to Z, from the time that they arrive to airport till they depart Iran. They will do consultation, and if required in the group, they will be available to translate everything. We have this facility to make everything smooth.
Great thing that patient will get this kind of facilities.
Yeah, exactly.
And they will receive the translator also in
Of course.
Iran, also in Bangladesh also.
Yeah.
Nice arrangement. So what is your opinion regarding the healthcare system in Bangladesh? What are the facilities? Because you are coming in Bangladesh for last 3-4 years and you are meeting some doctors, you also visit some hospitals also. What is your experience about healthcare system in Bangladesh?
I believe healthcare system in Bangladesh is improving and it is getting better, but the speed is not as much as it should be. Due to lack of the direct flights from Tehran to Dhaka, I have to visit another country, then come to Bangladesh. And during my stay in these countries, GCC country, I usually visit the hospitals there, have consultation and discussion with doctors there. I see their growth rate is higher, to be honest, compared to Bangladesh. So during this travel, I decided to give some, as I explained, some suggestions to private and public hospitals for training courses in Iran or for establishment of wards and hospitals inside Bangladesh with the presence of Iranian doctors, even online courses for the medical staffs, including nurses, midwives, doctors. So this will be speed up, inshallah, by these actions. I also received the agreement and permission from Iran Health Ministry and Iran Medical Council to collaborate in this issue, because my goal, my real goal from the bottom of my heart is to making medical system of Bangladesh one of the pioneer systems which Bangladeshi people deserve, maximum in next 10 years, in 20 years. This should be speed up to get this point of level.
That is important. You said that not only doctors, midwives, nurses, and health technicians also need training to develop this healthcare ecosystem in our country. I think I also agree with you.
Of course. You know, for example, in one country like Oman, maybe a great portion of the medical team comes from Iran. For example, including the technicians of laboratories, nurses, midwives, doctors, GP, specialists, subspecialists. So why not Bangladesh? Exactly. Especially if the direct flights start, medical staffs can travel to this country for services and for empowering. For example, when two persons are colleagues working together, they will learn from each other.
Exactly.
They will learn from each other, and then in future, if it is required, they can stay here, they can live here, they can marry here, or maybe they decide to return back.
Yes.
This is a personal decision that they made. But we should make the basis of these activities, and we should create this basis and this possibility so that Iranians can travel to Bangladesh, also the courses for medical members.
Great.
Especially midwives.
Exactly. Because that is important to sharing the experience. They can learn from each other. That is a very important thing, I think.
Exactly.
Another thing is that, this is the last portion, what is your future plan about Bangladesh market?
Now we have offices in Chittagong and in Dhaka. Maybe we are going to establish our office in Silhouette and other cities, one more city. So our offices in Bangladesh will be 4. Also the collaboration with hospitals, well-known hospital, unlike this public or private. We are making our collaboration stronger. On the other hand, we are working with tour operators to empower this process. As you may know, tour operators are not just active in sending the patient to other countries, even they are active in educational and training courses in different countries.
Exactly.
So they might be a reliable partners for us beside the support of government health system and beside the support of owners and medical directors of hospital who can fund and sponsor the these courses.
Nice. So you also open an office in Chittagong also.
Yeah.
In which place?
I should check the address as I have not
Okay.
been in Chittagong. I do not know.
This is your own office.
Yeah.
Okay. So you have currently office in Dhaka and Chittagong also, so patient can get services from both the centers.
Inside our website, the contact number of both offices are available.
Okay, great. Thank you, doctor,
My
for
pleasure.
coming with us.
Thanks for
Hopeful
your
that
time.
Iran will help us in future and Bangladeshi patients will get better treatment in Iran.
Inshallah, Iran will reflect the previous help of Bangladeshi doctors 40 years back to Iran. This time it's Iran's turn.
Inshallah.
Thank you.
Thank you very much.
Thank you.
এতক্ষণ আমরা কথা বললাম ইরানের হেলথ ট্রাভেল প্রফেশনাল এবং টেমমেড ট্যুরিজমের সিইও ডক্টর আলী বাজাজির সাথে। উনি কথা বললেন ইরানের ট্রিটমেন্ট ফ্যাসিলিটি নিয়ে, ইরানে বাংলাদেশি পেশেন্টরা কি কি সুবিধা পেতে পারে, কি কি ট্রিটমেন্ট তাদের জন্য ভালো এবং সেখানে ট্রিটমেন্টের খরচ কেমন, অ্যাকোমোডেশন কেমন, এবং তারা জানিয়েছেন যে অতি দ্রুত ইরান বাংলাদেশ ডিরেক্ট ফ্লাইট চালু হবে, তখন পেশেন্টদের জন্য ইরান যাওয়াটা আরও সহজ হবে। এবং অন্যদিকে তারা বলেছেন যে পেশেন্টদের জন্য তারা ইরান এম্বাসির সাথে কথা বলেছেন, ইরান এম্বাসি এনশিওর করেছেন যে বাংলাদেশি পেশেন্টদের ভিসা তারা ফ্রি করে দিবে এবং যেটি 3 থেকে 4 কর্মদিবসের মধ্যে পাওয়া সম্ভব। তো ইরান সরকার চেষ্টা করছে যে বাংলাদেশি পেশেন্টদের ট্রিটমেন্ট জার্নি যাতে হ্যাসেল ফ্রি হয়, এই জন্য ইরান গভর্নমেন্ট এবং ডক্টর আলী বাজাজি যৌথভাবে কাজ করে যাচ্ছেন। আমরা আশা করব আগামী দিনে বাংলাদেশি পেশেন্টরা যাতে বাইরে চিকিৎসা নিতে গিয়ে কোনো হয়রানির শিকার না হয় এবং সঠিক চিকিৎসা পায়, এটাই আমাদের প্রত্যাশা। এবং ডাক্তার বাজাজি আরেকটা জিনিস এনশিওর করেছেন, আগামীতে তারা বাংলাদেশি ডাক্তারদের স্কিল ডেভেলপমেন্টের জন্য বিভিন্ন ধরনের ট্রেনিং ফ্যাসিলিটি প্রোভাইড করবেন। 1 মাস থেকে 4 মাসের ট্রেনিং তারা ইরানের বিভিন্ন মেডিকেল ইউনিভার্সিটিতে অ্যারেঞ্জ করবেন। এবং আপনাদের যদি ইরানের চিকিৎসা সংক্রান্ত কোনো সহায়তার প্রয়োজন হয় তাহলে আপনারা মেডিকেলের সাথে যোগাযোগের জন্য এই ভিডিওর উপরে অথবা নিচে দেওয়া লিঙ্কে যোগাযোগ করুন। ধন্যবাদ, ভালো থাকুন।